Thank you. I am Dr. Aniket Inamdar, consultant physician from Umarga. So I will be presenting a study on harnessing the smartphone digital well-being technology to boost the physical activity in type 2 diabetes. This is a real world outcome data from the rural Maharashtra population. We know that physical inactivity and sedentary behavior worsens the glycemic control and increases the cardiometabolic risk in type 2 diabetes mellitus patients. And all the guidelines now recommend the more than 150 minutes of per week of moderate activity, which ultimately improves the HbA1c and insulin sensitivity. So we are now exposed to too much of screens now because of mobile addiction and too much of screens that we have in front of us in the form of technology. And recreational screen time is common, but it is a modifiable driver of sedentary behavior, and that has been linked in various studies to adverse diabetes related well-being and outcomes. So screen time more than 2 to 3 hours per day in the recent studies have shown the inverse correlation with the steps and the metabolic health. So we tried to use that smartphone digital well-being tool, which is a low-cost behavioral nudges which can improve the physical activity. So the objective was to assess whether the limiting recreational screen time to less than 150 minutes per day improves objectively measured physical activity in adults with type 2 diabetes. And the hypothesis was to reduce the screen time with reciprocally increasing the daily step count with behavior displacement. So the design was prospective 12-week intervention trial. 134 adults with type 2 diabetes with HbA1c more than 7, age more than 30 were included in this study. The intervention was active. We asked all the participants to activate the smartphone digital well-being feature, which is there in every phone setting, and ask them to reduce the the screen time to less than 150 minutes per day, and ask them to use the step counter or download the simple Google Health app to see how much steps they are doing, and ask them to reduce the screen time and increase the physical activity as much you can per day. So no any other variable we used in this particular study. So the outcome, we measured the mean daily steps and the screen time at baseline, 6 weeks and 12 weeks. And the analysis done by Pearson correlation. And what we found is this. So higher the more is the screen time, lesser was the step count, and lesser was the screen time, more was the physical activity behavior. So definitely limiting the screen time increases the physical activity and ultimately improves the glycemic control also. So the mean age in this particular study was 52 years. 58% were female. Baseline HbA1c was 8.4. 54% of the people achieved the screen time of less than 150 per minute day, and adherence showed 42% higher steps at the week 12 weeks versus non-adherence, and the strong inverse correlation we established in this particular study between the screen time and the steps. And in terms of type 2 glycemic control, so the random blood sugar improved in the adherent people. So screen time reduction definitely works as a behavioral lever, and it displaces the sedentary time with the movement. And digital well-being simple feature which is free of cost, available in every smartphone. We can use it to limit our sedentary behavior, and we can increase our physical activity. So digital well-being differs from the step promotion steps by targeting the upstream behavior. We are targeting the upstream behavior and displacing with something more positive. So the engagement in this particular study that we found was 92%. So 92% retention was there, which again supports that real world feasibility. And India being a poor resource limited country, we can use these low cost nudges to improve the physical activity behavior. And the findings of this study align well with the sedentary behavior meta-analysis and digital health literature that is recently published. So it is particularly relevant to India because we have the low resource settings, and with a high smartphone penetration with a very low data charges. India is the only country in the world which has very low data charges. But due to low data charges, we are more physically inactive because we are addicted to the more smartphone. So in this rural diabetes care, reducing recreational screen time using the native smartphone digital well-being tools strongly predict the meaningful increases in the objectively tracked steps. It offers a scalable, low cost, no new device. So you don't have to wear any new device, behavioral strategy that is well aligned with the international physical activity recommendations. So given the evidence that lifestyle and exercises interventions improve the HbA1c and cardiometabolic risk in type 2 diabetes, we need to integrate the smart screen time nudges into the standard counseling. Just we have to ask the patient to limit the screen time and just spend 1 more minute to ask them to be physically active and limit the steps per day to improve the ultimately the glycemic control. So the smartphone digital well-being is a scalable zero cost strategy to enhance the physical activity in type 2 diabetes patients, and we need to integrate it into the routine diabetes care, and that is very much promising, and we need to have more and more RCTs which are needed to establish the correlation between the cardiometabolic endpoints. Thank you.
Yeah.